Thanks, Rod. Can I have the slides, please? Right. So in the next few minutes, I'm going to be sharing with all of you the topic of dreaming bigger in the new digital era, how patient groups can tap into the power of health data and digital trends. Next slide, please. So the first question we need to answer is, why does health data matter? Well, health data are used to make evidence-based decisions and drive positive change in healthcare. And I understand that from the sessions yesterday, there was great interest in real-world evidence, real-world data. And this is actually really correlated to the topic. Data can actually help patient organizations advocate for policies that promote better outcomes for their members. So this is a given. This was also discussed yesterday, and I was pretty glad that was the case. Can I have the next slide, please? Now, when it comes to data, the common consensus is that in the old provider-centered care model, not the patient-centered care model, which we're trying to move towards to, in the old provider-centered care model, many a times it is physician-led. So physicians will try to impose onto you what you should do, many a times not taking into patient preferences into consideration. We're trying to change that. And the reason why we're trying to change that is we've come to realize, contrary to popular beliefs, patients actually do know better. So I have this graphic here that shows the typical joke that we have around when a physician would tell patients, don't Google search, trust my opinion. And the patient would say, hey, yes, you may have studied certain theoretical knowledge, you may know some of the biochemistry better than me with regards to my disease, but please do not underestimate my experience living with the disease. So, and this again is compounded by the fact that patients today actually have more access to health information than ever. There are so many knowledge databases, and this is no longer within the special access of healthcare professionals. And it is precisely this, patient organizations have this unique advantage. Patients do know better from a social perspective, personal preference perspective, living with diseases. So they do have this unique edge in health data, and they can be the one who's helping or assisting in the collection of this data for usage. So again, when it comes to real-world evidence, there's many ways patients can contribute to data collection, whether it's patient survey, helping with clinical trials, entering data into the electronic health records. There are many, many opportunities. And this will help close the gap between physicians and patients. So there's one golden opportunity right now, right there, the ability to communicate through data. Can I have the next slide, please? Now, the thing is, when we talk about patients having the ability to use data to influence, to help advocate policy changes, many times when you read literature on this, the material is presented in a way it seems to be very simple. All you got to do is to participate. Well, if only it is that simple. So I'm not here to pour cold water. I just need to highlight to interested individuals and patient organizations out there, data is important. It is an opportunity for patient organizations to be working alongside healthcare providers and other stakeholders, be it research, to work on data, to influence policy and better outcomes. But it is not easy. There's no easy cookie cutter solution or formula for any organizations out there to follow, because each disease profile is different. The country guidelines are different. But it is something that needs to be looked at. So I have an example here. Can I have the next? Yes. So if you see on screen, there's two dogs. There's two dogs there. One of the biggest challenge we have with regards to data is what we call semantic interpretation. So what you understand but when you present the data may not be what I understand. And this is where there's a great opportunity to harmonize. So case in point, if I were to talk to you about dogs, you may be thinking of the dog on the left, the Chihuahua. It's cute, cuddly, and small. I may be thinking of the pit bull, which is fiercer, maybe a little bit more dangerous. So you may be generating the emotions of happiness, whereas I may be generating the emotion of fear. But we're talking about the same thing, dog. So this is why it's important to have patients engage in defining data, collecting data. Now, again, it's not easy. You must have the right mindset, be prepared to work with organization, to be willing to put in the effort to reach that stage. Can I have the next slide, please? And as I said, although it is difficult, it can be done. I have this example here, which continues with the example of semantic interpretation from the last slide, where we talk about dogs, that you may think of the Chihuahua, and I may think of the pit bull. In this case, using patient data from 2 million patients to provide data points for diagnosing by a smartphone app, what this organization did is to standardize terminologies to make sure that whatever keywords, whatever data that's being put in is harmonized. And this is important because patients know best on what are the terms they prefer to express the proper feelings as it goes, so on and so forth. So this is a good opportunity for patients to get involved, to influence the patient acquisition process, as opposed to leaving it to just the healthcare organizations who may understand the disease from a biochemistry perspective, but not necessarily living with the disease itself. Can I have another example? Another slide, please. So in this example, I'd like to show to the audience there are other ways to utilize data indirectly. In this case, we're using artificial intelligence, predominantly predictive analytics. Because we have data, semantic data, that's really captured, we're able to run algorithms to actually detect early warning or sepsis infection. Now, there are many, many other ways where we can utilize AI to scan through, to pull through data within healthcare organizations and do similar patterns and trends analysis. And this has a direct impact on patients. Now, this is where there's another example where you might be thinking that, hey, I'm not contributing directly to the influencing at one aspect. But if you have done it well, there are other secondary use and opportunities for you to actually leverage on data that can be used to improve healthcare. Can I have the next slide, please? Now, having said this, some of the audience may be thinking, so where do I start at? I'm interested in contributing. Well, this is a big topic. Of course, we're not going to end this topic here just today. There's many other avenues to continue the conversation. But what I'd like to start off is to introduce or reintroduce to you the APPIS platform, where we have many, many resources, and we're going to add more to help you in your journey towards using data, be it for social media, be it for data analytics, to help leverage them to empower patient organizations to have a say in health policy making. So in this case on screen, there's actually 3 white papers and documents that touches on patient experience, patient engagement, and then using digital technologies to enable a patient-centered care solutions. Can you click on it? Yes. So if you look at the various white papers, there are many, many other contents within the white papers. There are specific sections you can see on screen where they talk precisely about leveraging data to increase information, understanding, standardizing for patient registry, and then using data to undertake patient-centered innovations, so on and so forth. So this is the number one starting point you have towards this journey in utilizing data. Can you click next, please? And right here, we have the QR code for interested parties to access more. Next slide, please. With this, I really want to give a shout out to everyone present here today. And also, please do share the information with your friends who are interested to dream bigger in the digital era. This is the era where patient empowerment is very strong. You guys have access to technology. It's no longer the tools of just healthcare organization. Now, having said that, the APPIS Resource Center, as I mentioned, is a starting point. One important note that I'd like to re-emphasize to everyone is this APPIS Summit that we're having for the past 2 days, yesterday and today, is just the starting point. It's an annual summit. It's not a one-off event. APPIS provides numerous other programs throughout the year to empower patient organizations, equipping patient organizations with skills, knowledge, etc. And one of them would be the APPIS Innovator Program, which I believe more details will be shared later. But what I like to do is to also give a shout out to interested individuals and patient organizations. If you have an idea on how to innovate with regards to digital solutions, with regards to data, please do join the APPIS Innovator Program, where we'll contribute more resources to help you in your journey. Can I have the next slide, please? Can I have the next slide, please? Okay, so I guess that's the end of the presentation. With that, I'll end this presentation. I believe there's a Q&A session. Right, so to help me with my Q&A, I'd like to invite my friend, Duo, to come on to screen for this segment.
Hi, Adam. Hi, how are you? Hey, I know many people will call you Dr. Adam Chee, but since you mentioned I'm your friend and also you're an old friend of the APPIS platform, so Adam. So actually, thanks so much for being here with us today. I think it's really important to have you to provide this outside-in perspective as a digital health expert and also academic. And then actually my first question here from the audience is really about how to embrace change, right? How to dream bigger. Thanks for encouraging us. Thanks for even challenging us to dream bigger. But as you know, human beings are not really wired to embrace change. So what are the, kind of the small steps or the starting points that you would suggest that we can take, that the APPIS community can take to enable bigger changes in future?
That is a fantastic question, Duo. I think first thing first, we must, as I mentioned, we acknowledge that this is important. It is not easy. So I think the first real step patient organizations will have to take is to embrace it and take a step forward and say, hey, I want to be part of this health data trend. Because if you're not part of the conversation, if you choose not to be part of the conversation will continue without you. And there'll be a very sad situation because, as I mentioned, patients do know better. So the first real step is really to raise your hand, reach out to the organizations in your region who may be working on initiatives that could help to influence policy or interventions, be it medical, social policy interventions that will help patients' community. So that's really the first step that I would encourage all patient organizations to take, to voice out, to demonstrate interest, to say, hey, I want to be part of that conversation.
Yep, that's very clear. I think this being proactive is a very important first step. And also, I think, as you mentioned, we need to have the right mindset to start with. And then actually, there's a second question coming from the audience, which is also relevant, which is actually about capability. So from your perspective, in order to reach out to relevant partners or stakeholders, from your standpoint, what would be the necessary capability or capacity on the part of patient organizations?
Another fantastic question. Now, due to these different disease profiles, region, and the programs that's being initiated, the the required capabilities or skill sets, if you will be slightly different. But patient organizations don't really have to fear that, because whoever they'll be working with, it is actually in the healthcare organizations, the research institutes' interest to empower you with the skill set to help them. So that's the number one key information that you must have at the back of your mind. Yes, at this point in time, you may be unsure, you may be a little bit fearful of change, but take a first step and reach out, and then work with these organizations. They will be guiding you on what is necessary on your part to help them. So it's a situation of they will help you to help them help you. So I hope that was clear. That's number one. Second, as I mentioned, APPIS is an annual event. In fact, it's not just an annual event, it's an ongoing event, because we repeat it we continue every year. And there'll be lots of resources available out there. It is APPIS mission to empower patient organizations. So in addition to the healthcare organizations, the research institutions that you may want to work with in your region, work with us, work with APPIS, voice out, and we've been more than happy to be part of your journey in using digital solutions and data.
Thanks for the very kind words about the APPIS platform, Adam. I think having you and also all the other thought leaders coming from the entire healthcare ecosystem actually will help the APPIS platform to be a better partner when it comes to working closely with patient communities and other stakeholders to drive positive changes to society and to health in general. I think we have time for a last question, which is a bit, which can be a bit challenging to answer, but I'm just gonna throw this question at you if you don't mind. So a lot of our countries or territories in this part of the world are actually reluctant to allow access to health system patient data to patient groups. So if that's the case, what would be your advice in these instances?
There are many ways to do it. Sometimes change takes time. So really reaching out and understanding why they're not willing to release data could be number one step to initiating such change. But there are also other opportunities, because today the world is no longer confined to geographical region. There are many opportunities to contribute insights, experience, and data that will help international organizations as well. And it works both ways. Sometimes organizations don't know where to start because they have this impression that perhaps patients are not interested. You have to admit, patients sometimes can be very shy. Okay, so if you have patient organizations starting to reach out to such organizations, it's actually a clear beacon showing that, hey, there's someone here that's willing to work with you, and trust me, they'll be rushing to grab such opportunities.
So I guess the key message is, in addition to dreaming bigger, also please don't be shy when it comes to, yeah. Okay, thank you, Adam. I'll let you wrap up the session. Nice to have you here.